Hello everyone, welcome to my YouTube channel, Dr. Martius Yamamoto, Medical Acupuncture, a medicine without medicines. In this video, I will present some of the physiological and neurochemical principles that govern the application of needles on the surface of the skin and all of the chemical reactions that occur when a needle is inserted on the skin or the muscle. I'm also a mechanical engineer, and I have a biomedical degree, a master's in biomedical engineering, and I was also granted with a scholarship to pursue a doctoral degree in aerospace engineering at Princeton University. And I had a chance, of course, to work for a number of years at the National Laboratory for Computer Sciences in Brazil as a researcher. And one thing that I had to study consistently is scientific methodology, which is a way in which we have to conduct research with rigor, with all the rigors of science. And I also had a chance as a doctor, as a physician, to read lots and lots of research works provided by medical scholars and biochemists studying medical acupuncture or acupuncture, traditional acupuncture. Whenever we apply scientific methodology, we have to use hypothesis. And one of the hypotheses they use is that there are certain points on the surface of the body, on our skin, which are called acupoints. And there are the other points which are not acupoints, or traditional places where insert the needles according to traditional Chinese medicine, are neutral points, and they're called sham points. So they bring up this question of practicing sham acupuncture, and they compare sham acupuncture with needling acupoints, and they base their research work on this assumption. What if I tell you that this assumption is not so correct as they say, as they argue? Because my Chinese professors of acupuncture have argued with me that any part of the body, any place on the surface of the skin is in fact an acupoint, depending on the situation that we are treating. For example, suppose that I have an inflammatory process occurring in the forearm and in the elbow of my left arm. Any place where I insert needle is considered to be an acupoint. Although these points are not traditional acupoints according to traditional Chinese medicine, they are indeed acupoints. So there is no such a thing as sham acupuncture, as is argued by hundreds of scientists and medical researchers which try to debunk traditional Chinese medicine and acupuncture as a form of practicing medicine. If we use wrong hypothesis, the entire research work is compromised. So when we start a research work, we have to adopt hypothesis using correct assumptions and using correct data and knowledge in order to prove our point of view during the course of our research work. And I have noticed that many of them depart from the wrong assumption that there are sham points on the surface of the skin. And that's why the results of researchers that study acupuncture are so controversial, indicating in most cases that acupuncture is nothing but a placebo method of practicing medicine. We have to understand that there are certain interests at play, and there is enormous pressure on the pharmaceutical industry in order to debunk acupuncture as a form of practicing medicine, because acupuncture uses needles that cost cents of dollars, and since they yield no financial profit, there is this necessity to disregard, to play down the importance of complementary medicine, such as acupuncture, as a form of treating disease which otherwise are treated with medications, which cost money. And we have to remember also that many research works conducted by American universities and universities across the world are financed by these pharmaceutical industries, as other mega organizations that try to prove that their product or their substance is useful, as in the case, for example, of certain pesticides, or they try to prove that they inflict no harm to people or insects, and some of these research proved to be absolutely wrong, as we learn later with the passing years. And this is the case with acupuncture, since it yields no profits. It's almost free, a free way of practicing medicine. So ponder about, think about, and then you take your own conclusions. When I insert a needle on any point, I trigger a number of chemical reactions and physiological reactions, and locally and all over the body, caused by release of endogenous substances in our organism. And when I insert a needle, for example, into the skin and the nerve, I stimulate nerve endings in the skin and the muscle, which release a substance, endogenous substance, called nitric oxide, that provokes vasodilation, which means an increase of the caliber of blood vessels, and also analgesia. When I increase the caliber of blood vessels, I increase the blood flow through the area. And in this way, I sort of scavenge inflammatory substances such as interleukins 1, 2, 3, and 4, and also tumoral necrosis factor, which are substances that cause pain. So locally, whenever I introduce a needle, I release this nitric oxide, which is an endogenous substance, and I cause this reaction. There is a reddening. There is because I increased blood flow. There is some itching because I release a little histamine, and this cleansing of inflammatory substances in the area. So these nerve endings right here and at the end, at the tip of the needle, make connections or synapses with neurons in the spinal cord, which are in the backbone, unleashing neurotransmitters such as enkephalins, mainly enkephalin 7 and enkephalin 9, and also a neurotransmitter called gamma-aminobutyric acid, or GABA. GABA is very important in the blocking of conduction of pain, such as enkephalins, but GABA also induces drowsiness and a sleeping and relaxing sensation in the body, so that whenever we go to sleep, large amounts of GABA are released into the brain so that we can sleep. The insertion of needles in the muscles also triggers a reflexive reaction in the spinal cord, producing MYORELAXANT reactions in the muscle, reducing muscle spasm. In the spinal cord, in the brain, there is also a reaction because the electric signal conducted by the neuron ascends and eventually reaches the brain, and there in the brain, I don't like much to use some mad speak, but we'll have to use in this way. There is a part of the brain in which occurs what we call a suprasegmental reaction, involving certain parts of the brain, which are the brainstem, diencephalum, and the telencephalum. This suprasegmental reaction triggers very complex mechanisms that explain why the insertion of needles on a certain point is able to alleviate the pain on a distant place. That's why during a typical acupuncture session, you may feel a lower back pain, and you apply the needles, of course, in the lower back pain in order to alleviate the inflammation process by releasing this nitric oxide on the region. But we also insert needles, for example, in distant places, such as the leg, for example, at a typical point like Susan Lee or stomach 36, which is well known to acupuncturists, which reduce the pain, or gallbladder 34, which also reduces the pain of the lower back muscles. Also, opioids are released. Opioids are substances, morphine-like substances. They are produced by the hypothalamus and hypophysis, and they are mainly of two types: beta endorphin and dynorphin, which are very similar to morphine. Beta endorphin and dynorphin, once released by the hypothalamus and hypophysis, they minimize the perception of pain in the muscle. Also, there is a part of the brain that we call periaqueductal gray, which triggers a descending inhibitory mechanism of pain, which is perhaps the most efficacious area of the brain to inhibit pain through regular microbursts of morphine into the bloodstream. So you see that by simply applying a needle, a single needle, we trigger a chain reaction in the body, causing the release of numerous substances that diminishes pain. In this case, I'm addressing pain, which is extremely connected with such specialties, medical specialties as orthopedics or neurology or even endocrinology. And also, since we release neurotransmitters in the brain, such as serotonin, that we'll talk about later, we have a close connection with psychiatry when using acupuncture. Serotonin is a neurotransmitter that is released when we insert a needle, and it's produced in the brain by the nucleus accumbens. It's a very difficult, it's a jawbreaker word, but it means that the brain is capable of producing serotonin and release the serotonin through the insertion of a needle on the surface of the skin. And see, pay attention, I'm using a sham point, I'm not using an acupoint. And that's the biggest mistake that most researchers make, because lack of information about how acupuncture is practiced in China. And this lack of knowledge leads to making wrong assumptions, assuming that there are sham points, that means neutral points, and there are acupoints, that means points which are actively working in the body, provoking these chemical reactions. It is pretty much like it keeps a great resemblance with a bee sting, for example, or a jellyfish sting. We all know that no matter in what place the bee stings or the jellyfish stings in skin, it will cause intense pain, burning sensation, inflammation, reddening of the area, and even infection sometimes. So there is no such a thing as a sting point when it comes to bees, because we know that whatever the place a bee stings is on skin, it will provoke all these reactions caused by the venom introduced by the sting of the bee. So we don't talk about sham points of bee stings and sting points caused by bee stings. So this is a wrong assumption. That would be a wrong assumption, since we have a direct experience from our daily lives. We all know that this assumption is wrong. The same occurs with acupuncture. We assume the wrong assumption that there is a sham point of acupuncture and there is an acupoint that is effective. And this is a concept which must be eliminated in research works. So there is also a reaction that occurs, a chemical reaction that occurs once a needle is inserted on the muscle. It provokes the production, it increases the production of a hormone which is called ACTH, or adrenocorticotropic hormone, which is released by adrenal glands. Adrenal glands are glands which are situated over the kidneys, right over the kidneys. And they are often known for releasing a substance which is called cortisol. Cortisol is often released during stressful situations. For example, you are overworking, working overtime, or you're tending for your children and you're making a mess in your house. So, or you're discussing with, you're having an argument with your partner. In these cases, you release a hormone which is called cortisol, and the substance cortisol is an indicator of stress, and it's often used in blood tests, blood exams, to indicate if you're experiencing or going through a stressful situation. But in the case of inserting a needle, the release of cortisol has a powerful inflammatory action on the muscles where you're feeling the pain. So these are the basic actions and chemical reactions that occur when inserting a needle on the surface of the skin, a simple needle. They have local actions by release of nitric oxide. They have a spinal cord action by the release of neurotransmitters enkephalin and GABA, which block the conduction of pain. And they also have a brain action by the release of neurotransmitters like beta endorphin and dynorphin in the hypothalamus and hypophysis, and an inhibitory mechanism of pain by the periaqueductal gray in the brain, and an increase of cortisol, which has a powerful inflammatory action on the adrenal glands. Now let's go to a typical acupuncture session. There are many differences of acupuncture sessions across the world because China is nearly a continental country. It's much bigger than the US. So the way an acupuncturist, a medical acupuncturist, practice needling in acupuncture on a place in north of China is different from the way he practices in the south of China, for example, in Hong Kong or Taiwan or Beijing, so or other cities in China, like Shanghai, for example. So I will try to use the technique that my Chinese teachers explained to me when I was studying Chinese acupuncture. They first demarcate or delineate the places in which you feel the most acute pain on your body. I'm taking the example of a muscular pain. That I could take many other examples to explain how an acupuncture session is conducted. But in this case, we'll talk about analgesia and anti-inflammatory properties of acupuncture. So let's suppose that I have an epicondylitis, which means that I have an inflammation here in the elbow. I delineate the area. This is not something that most acupuncturists do. This is what I do. And suppose that I feel a pain radiating out from the elbow directly into the forearm. And let's imagine that I feel extreme pain at these points, here that I will mark. The second thing that we do is to insert the needles on these points. Insert the needle here. And here. Let me apply it deeply. I insert the needle here. And here. In America, most acupuncturists tend to insert the needles on the very surface of the skin, and this has also an adverse effect, which means that when I insert a needle, and my Chinese professor explained this to me, when I insert a needle on the very surface of the skin, the reactions, the chemical reactions that occurs will be much less intense in nature than if I insert needle deeply into the muscle and reaching the nerve endings and creating that synapses with neurons that go into the spinal cord. So it is important to insert needles at a certain depth, and this is not what occurs to most acupuncturists that I had the opportunity to see in the US. They apply the needle at a very superficial level, and you decrease the effectiveness of the acupuncture session. So this will also have a result when we are conducting a research work studying the actions of needling a patient. The second thing that we'll do after triggering all these chemical reactions is using a device which we call a moxibustion. A moxibustion in olden times were made of coal. They were a coal bar that was burned and heated the needles. That's why I don't use needles with plastic collars, which may be very beautiful when we take snapshots of an acupuncture session, but are very ineffective when we have to apply moxibustion, which is often used to treat inflammatory areas like this one. So I will pick up, if you'll excuse me, the moxibustion, and I will turn it on. I'm using an electric moxibustion like this one. You will see that it will begin to become orange. That means it's getting very hot. You see here, it's becoming hot. And I will apply the moxibustion on the top of every needle. I will heat up the needles, and the temperature at the tip of the needle, which is inserted in the muscle, will reach about 50 degrees Celsius, which increases the blood flow in the muscle and causes relaxation of the muscle. And by increasing the blood flow, I scavenge inflammatory substances present in the muscle. I will also use moxibustion here. So I'm heating the needle, That's why I can't use toppings made of plastic, because I will melt them out. And here and here. Do this for some time. Of course, I should have done this for a longer period of time, but since this is a demonstration, I will be more practical and try to use more speed to demonstrate how a typical acupuncture session occurs. Now I'll turn off the mouse button, and then I will leave for a few minutes, a period of 10 to 15, sometimes 20 minutes, so that all these substances go into the bloodstream and produce a reduction of pain, so that all these substances go through the neurons and block the feeling, the conduction of pain, and so that there is a local action in the area, provoking analgesia and relaxation of the muscles. And this takes about 15 to 20 minutes about. See that I'm using sham points, not acupoints, and I'm having exactly the same effects. And this is a very, very wrong assumption on part of many researchers in many countries that try to unfortunately prove that acupuncture is not a form of medicine, but pseudo-medicine. So after some time, I release the needles, I take off the needles, and then I apply an oil, which is not common practice, but this oil creates an enormous adherence. Of course, it has anti-inflammatory properties, but since I'm also a dermatologist, I know that this anti-inflammatory properties won't be felt in deeper layers of the skin, because they will not be able to penetrate the epidermis, and they will remain on the surface. That's just used as a means of creating more adherence with suction cups that I will use here with a pistol to apply on the place where I feel most pain. Oops. All right. I will apply suckers. I'll pick up the other cup. And apply suction. When I apply suction on these areas, they immediately become very red, and I increase the blood flow, and I sort of pull the epidermis, the dermis, the subcutaneous tissues, and the muscle, and I cause attraction of the muscle. Let's reapply on the surface again, because the section is not working very properly. When I cause attraction of the muscle, I tend to cause a stretching of the inflamed muscle. I increase blood flow. I stretch the muscle and the fascia, which is a flat type of muscle which is whitish and papery in texture and color, which often adheres to the muscle below, and it blocks the movement, the free movement of muscle, causing a lot of pain and limitation in movement. I leave these cups for a few minutes, and then suppose that some 5 minutes have passed, and I take the cups. Then I clean up the surface with a napkin here, and my acupuncture session is over. As you can see, I didn't feel almost any pain. I just felt a kind of a pricking on the surface of the skin, because you have to remember these needles are extremely thin, and I feel a greater relaxation caused by the release of serotonin into the bloodstream. It's important to remember that although serotonin is released in the nucleus accumbens by the insertion of needles, 95% of the serotonin is produced by the intestines. So it's extremely important to make a very good nutrition, healthy nutrition, in order that the intestines produce greater amounts of serotonin and cause that relaxation and well-being sensation in your body. And that's how we practice an acupuncture session. I've tried to stress the main substances that are released during an acupuncture session, and I hope you have enjoyed this introduction to medical acupuncture. And if you liked the video, please subscribe to it, leave a like, and make your comments, post your comments. Thank you very much. Until next time.